Humira is a tumor necrosis factor blocker that reduces the effect of a substance in the body that can cause inflammation. The active substance is adalimumab. Humira is used to treat many inflammatory conditions in adults such as rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, plaque psoriasis, and a skin condition called hidradenitis suppurativa. Humira is also used in adults and children to treat Crohn's disease, juvenile idiopathic arthritis, ulcerative colitis, and uveitis. How should I use Humira? Use Humira exactly as prescribed by a doctor. Follow all directions on a prescription label and read all medication guides or instruction sheets. Use the medicine exactly as directed. Humira is injected under the skin. A healthcare provider will teach you how to properly use this medicine by yourself. Do not start using this medicine if you have any signs of an infection. Call a doctor for instructions. The dose schedule for Humira is highly variable and depends on the condition you are treating. Prepare your injection only when you are ready to give it. Don't use if the medicine looks cloudy, has changed color, or has particles in it. Call a pharmacist for new medicine. Humira affects your immune system. You may get infections more easily, even serious or fatal infections. Your doctor will need to examine you on a regular basis. Throw away any Humira that has become frozen. Usual dose of Humira for psoriatic arthritis: 40 mg subcutaneously every other week. In some patients not taking concomitant methotrexate, the dosing interval may be increased to 40 mg every week. Methotrexate, glucocorticoids, salicylates, nonsteroidal anti-inflammatory drugs, analgesic, or other disease-modifying agents may be given concomitantly. Usual dose for Crohn's disease: acute. Initial dose 160 mg subcutaneously on day 1. The initial dose may be given as 4 injections on day 1, or as 2 injections per day for 2 consecutive days, day 1 and day 2. Week 2, 80 mg subcutaneously on day 15. Beginning week 4, day 29, 40 mg every other week. Aminosalicylates, corticosteroids, and/or immunomodulatory agents may be continued during treatment with adalimumab. The use of adalimumab for Crohn's disease beyond 1 year had not been evaluated in controlled clinical studies. Usual dose of Humira for Crohn's disease: maintenance. Initial dose 160 mg subcutaneously on day 1. The initial dose may be given as 4 injections on day 1, or as 2 injections per day for 2 consecutive days, day 1 and day 2. Week 2, 80 mg subcutaneously on day 15. Maintenance dose, beginning week 4, day 29, 40 mg every other week. Aminosalicylates, corticosteroids, and/or immunomodulatory agents may be continued during treatment with Humira. The use of adalimumab for Crohn's disease beyond 1 year had not been evaluated in controlled clinical studies. Usual adult dose for ulcerative colitis: initial dose 160 mg subcutaneously on day 1. The initial dose may be given as 4 injections on day 1, or as 2 injections per day for 2 consecutive days, day 1 and 2. Week 2, 80 mg subcutaneously on day 15. Maintenance dose, beginning week 4, day 29, 40 mg every other week. Usual dose for plaque psoriasis: initial dose 80 mg subcutaneously. Maintenance dose 40 mg subcutaneously every other week, starting 1 week after initial dose. Usual pediatric dose for juvenile idiopathic arthritis: 4 to 17 years. Limited data are available for Humira treatment in pediatric patients with a weight below 15 kg. 15 kg to less than 30 kg, 20 mg every other week. Greater than or equal to 30 kg, 40 mg every other week. Methotrexate, glucocorticosteroids, salicylates, NSAIDs or analgesics may be continued during treatment with Humira. Before taking this medicine, you should not use Humira if you are allergic to adalimumab. Before you start using this medicine, tell a doctor if you have signs of an infection: fever, chills, sweats, muscle aches, tiredness, cough, bloody mucus, skin sores, diarrhea, burning when you urinate, or feeling constantly tired. Humira should not be given to a child younger than 2 years old or 6 years old if treating Crohn's disease. Children using this medicine should be carried on all childhood immunization before starting treatment. Tell a doctor if you have ever had tuberculosis, or if anyone in your household has tuberculosis, a chronic infection, cancer, hepatitis B. Adalimumab can cause hepatitis B to come back or get worse, diabetes, heart failure, any numbness or tingling or nerve muscle disorders such as multiple sclerosis or Guillain-Barré syndrome, an allergy to latex rubber, if you are scheduled to have major surgery, if you have recently received or have scheduled to receive any vaccine. Warnings: Humira affects your immune system. Adalimumab can allow the ability of your immune system to fight infections, and you may get infections more easily. Serious infections caused by viruses, fungi, or bacteria have been happening in people taking this medicine. Some people have died from these infections. Serious infections include tuberculosis. Your doctor should test you for tuberculosis before starting and during treatment with Humira. Before doing treatment with Humira, tell a doctor if you have signs of an infection such as fever, chills, aches, tiredness, cough, skin sores, diarrhea, or burning when you urinate. Humira side effects. Get emergency medical help if you have any of the signs of an allergic reaction to Humira, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Call a doctor right away if you have any symptoms of lymphoma, fever, swollen glands, night sweats, general feeling or illness, joint and muscle pain, skin rash, easy bruising or bleeding, pale skin, feeling lightheaded or short of breath, cold hands and feet, pain in your upper stomach that may spread to your shoulder, loss of appetite, feeling full after eating only a small amount, weight loss. Also call a doctor at once if you have new or worsening psoriasis, raised, silvery flaking of the skin, a sore or bump on your skin that does not heal, symptoms of sepsis, confusion, chills, severe drowsiness, fast heartbeat, rapid breathing, feeling very ill, liver problems, body aches, tiredness, stomach pain, right side upper stomach pain, vomiting, loss of appetite, dark urine, clay-colored stools, jaundice, yellowing of the skin or eyes, lupus-like syndrome, joint pain or swelling, chest pain, shortness of breath, patchy skin color that worsens in sunlight, nerve problems, numbness, stinging, dizziness, vision problems, weakness in your arms or legs, signs of tuberculosis, fever with ongoing cough, weight loss, fat or muscle. Older adults may be more likely to develop infections or cancer while using adalimumab.